Over half of women in perimenopause and menopause have musculoskeletal issues that are probably related to the menopause transition, but they are underreported because people do not know that the orthopedic issues that you're having that are just snowballing you are due to the change in your body during this menopause transition. In this particular article, the musculoskeletal manifestations of perimenopause, which by the way, when it comes on during perimenopause, it still hangs on postmenopause, a systematic review and meta-analysis of 93,021 women. This just came out in January 2026. The perimenopause transition appears to be a crucial time when women first develop the musculoskeletal pain, and some studies suggest that declining estrogen levels may contribute to inflammation of the musculoskeletal tissues. We need to recognize that orthopedic issues is part of the menopause transition, and it is underreported because people don't put the two and two together. Because it really wasn't until the late 90s that we even really recognized that like the estrogen receptors were in the tendons. Okay. Like I don't even know that pop culture people know this. Like it's not a normalized thing. Like people don't talk about this. But if you stop and think about it, we had to have hormones affect our tendons if you have a vagina, because if you want your baby to come out of you, we needed those hormone fluctuations to help us change the stress strain curve so that the cervix can dilate open and all these things happened. Our pelvis could have never birthed the baby if we didn't have hormone fluctuations. We should have known. But I digress. In this particular study, they're not even like directly talking about, there is no orthopedic scale for menopause joint pain. There's no scale. What we do know is that when we test things on our little mice and our rats, several animal studies have demonstrated that reduced estrogen levels adversely affect the synovium and the joint cartilage. But because we don't have enough research on this, the relationship remains uncertain, as age itself is a competing factor in this patient population. So true. Age, of course, is part of this. Men also have declining hormones, but the dysfunctions men have versus women, as a physical therapist, it is night and day. It is night and day. So we do not have enough information on this, but this is where it all starts. There's an art and a science to what we do. So I'm pleased to say that we now do have guidelines for managing menopause symptoms that are like hot flashes, the genitourinary symptom of menopause. We have things for mood and sleep, but not for musculoskeletal issues. And that's why I'm on here talking about your tendons, okay? Talking about your muscles. I'm here to tell you, we have to help the tendons remodel or our joint pain will not go away. We have to choose our exercises strategically because you only have so much time. Many women presenting with these musculoskeletal symptoms, the pain that they have, they never really receive a clear diagnosis, making it also difficult to treat from a perspective of clinicians. I would wager to say a lot of this pain is fascial pain and tendonitis. So this study took data from 22 countries. And fun fact, if you have not researched the musculoskeletal injuries with women in the menopause transition, it is very different, different cultures based on what we eat, based on what we do. For instance, in Japan, they do not have the frozen shoulder. In India, they have their whole different subset, indicating a potential inflection point at the menopause transition. Yes, when the estrogen declines, it forever changes the pliabilities of the pliability of the tissue. The specific cause of the diagnosis associated with the musculoskeletal symptoms were poorly reported. Common orthopedic conditions such as osteoarthritis, tendinopathies, synovitis, and bursitis were rarely specified. And findings from animal studies suggest that female hormones have an important influence on inflammation-induced cartilage breakdown. A clinical study by Liu et al. Investigated the association between menopause and the severity of knee joint cartilage degeneration. And they showed that the severity of cartilage degeneration increased significantly from premenopause to perimenopause state and then to postmenopausal state. Women have a significantly higher prevalence of OA in comparison with their male counterparts, as females account for 60% of osteoarthritis cases globally. Now, there are many reasons for that, but I do believe that how the cartilage is maintained is definitely helped by estrogen. We also have a wider Q angle. We go through more trauma through pregnancy, and so I think that's multivariable, but 100% our estrogen affects our cartilage and our tendons. Radiographic studies of knee cartilage loss show that women experience faster deterioration than men, with the gap becoming more pronounced after the age of 50, potentially implicating the decline of estrogen. The average age of menopause in the U.S. is 51. Menopause is reached when you are 365 days since your last cycle. So, Hormones, when they fluctuate, can alter properties of soft tissues such as muscles, tendons, and ligaments. Estrogen maintain energy homeostasis and promote metabolic health throughout the body, and the decline in estrogens during menopause appear to reduce muscle function. This decline can also lead to changes such as decreased collagen production, reduced tendon and ligament elasticity, and overall weakening of connective tissue, which may increase the risk of inflammation, injury, and tendon pathology. Your Honor, I rest my case.